Patients come into my office all the time, and I ask questions when the patient comes in because I want to know what it is that you want. I mean, believe it or not, people think they come into the dentist office to get veneers or get crowns or get implants or have a tooth pulled. But that's not really why you come into our office. The real reason you come into our office is for quality of life issues. I want to look better, or I'm in pain and I want to feel better, or I can't chew my food anymore, so my health is being affected because I can't chew my food up properly, so when I swallow my food, it's not being digested well. That's a problem. You want to make sure that you're able to chew your food better. So when you come into my office, that's what I want to hear from you. Do you want your teeth to look better? Are you in pain? Do you want to feel better? Or, hey, Mike, I can't chew my food, and I want you to help me so that I can chew my food better so that I live longer. So what my job for you is I need to determine where your risk is. So every person that comes into my practice, I do a risk assessment on you. And there are 4 things that I look at. Number 1, I look at the gums and bone. Is your gum tissue healthy? Do you have adequate bone support around your teeth? The second thing I look at are your teeth themselves. Do you have any root canals, posting cores? Do you have any crowns? Do you have any active decay? Do you have any erosion on your teeth? And so I'm developing this risk assessment. You know, do you have teeth that if you keep them longer, they may break off and you might lose them? The third thing I look at is your joint, your jaw joint, your chewing surfaces of your teeth, and the muscles that make your teeth, your jaws move up and down. And then the last thing we look at is aesthetics. So aesthetics are when you smile, do you show teeth, do you show gums, how is that all going to look? So in each one of those different categories, I give you a risk assessment. Green is good, red is bad, and yellow is somewhere in the middle. Just like when you go to have your car oil changed, they look at your tires. If you've got brand new tires on your car, you've got 40,000 miles to go, you get a green dot. If you're driving around, you've got another 15,000 miles on these tires, so you're going to need to be thinking about replacing them, you get a yellow dot. If you're driving around on baldies, red dot. You need new tires. Well, that's the same thing I do in my practice, is that I want to determine whether or not you're going to keep your teeth. And if you're going to lose your teeth, are you going to lose them to decay? Or are you going to lose them to bone loss? Or are you going to grind them away to nothing? And so each person that comes in, it's going to be different for that person. So each treatment plan we do for a person is going to be stylized to whatever's going wrong in your mouth to give you the best chance of success. And if you have a tooth that's borderline, that may work and it may not, it's your decision to make whether or not you want to keep it or not. And by giving you all of this information, you can make your own decision as to what's going to be best for you. And so we drive your treatment to minimize the risk where you have the highest level of risk. So if you have teeth that are decayed, then that's the highest risk. If you have bone loss around your teeth, then that's the highest risk. And we make a treatment plan that's going to make it so that we minimize the long-term effects of those problems for you.